consent to being recorded. So, hello and welcome to the latest COVID-19 media briefing by Nottingham City Council, Nottinghamshire County Council and the NHS. It's Friday the 21st of January. As always, we'll give an update from our organisations on our response to COVID-19 and then we'll throw it open for questions from the media. On the panel we have Lucy Hubber, Director of Public Health in Nottingham, Jonathan Griffin, Director of Public Health in Nottinghamshire, and Amanda Sullivan, who's the Accountable Officer for the NHS across both Nottingham and Nottinghamshire. After their updates, please raise your hand and we'll come to you one at a time. But can I ask that you remain on mute with your cameras off until it's your turn to ask a question? And for the purpose of the recording, it's really helpful that when you ask a question, if you can identify yourself and which media you represent. Thank you. So to get underway, I'll hand over first to Jonathan Griffin.
Thank you, Steve, and good morning, everyone. Steve, I've had problems with my microphone this week. I hope you'll just interject if it's muffled, but I shall plough on because I want to bring you some data which overall will show a reduction in COVID rates across Nottinghamshire and also a flattening off in the number of people in hospital with COVID in Nottinghamshire, albeit a flattening off at levels which really are very challenging for our services still. But this does bring us to another transition point as we now return to Winter Plan A. But before I turn to that, I want to take a quick look back, if I may, over the last 8 weeks, because tomorrow will mark 8 weeks since Saturday, 27th of November, where in Nottinghamshire we detected the first case of Omicron. And in those 8 weeks, in Nottinghamshire County, more than 369,000 people have received PCR tests, and amongst those, over 68,000 people in Nottinghamshire County have received a positive PCR result. That's just a little bit over 1/3 of all of the positive PCR results that have been received in Nottinghamshire County in the entire pandemic period. Now, of course, very early on in the pandemic, we didn't have all of that infrastructure in place. And as you will recall, over these last 8 weeks, at one or two moments, some of that testing infrastructure has creaked a bit under the enormous demand. But I wanted to highlight those numbers to you, really to underline the enormous surge in cases that we've experienced in Nottinghamshire over the last 8 weeks, the very sharp increases which we've seen. And of course, as a result of the isolation, self-isolating and the illness associated with that, there have been impacts for businesses, for households, for families, and for services, and some of those I know are still being felt very much so. But Nottinghamshire responded to all of that, not only by getting tested, but by coming forward to getting vaccinated, booking their boosters, for many people for reducing the amount that they were mixing with other people and thinking very carefully about the social contacts they would have in the run-up to Christmas. And in these and in a number of other ways, responded really positively to what we saw coming in terms of that big wave. And I want to take this opportunity to thank people in Nottinghamshire again for all that they've done over these recent weeks, because it's through those measures and efforts, it's through the care that people have exercised on behalf of their families, communities around them. It's the caution that they've exercised in terms of the way that they thought about impacts potentially for our services, that we now reach this point now where we are returning to Winter Plan A. So the situation today in Nottinghamshire is that in comparison with the England rate, which currently stands at 967 per 100,000, in Nottinghamshire County, the rate stands at 909 per 100,000. So that's just a little bit beneath England average at the moment. That still means that more than 1,000 people in a day in Nottinghamshire County are testing positive for coronavirus, but it represents a really significant reduction compared with a week or two ago. Nevertheless, I do also have to mention that there are some early signs in Nottinghamshire County that those reductions may already be starting to flatten off, and we'll be having to watch that really very carefully over the coming days. Because although we've come down now from what appears to be the very highest peak, we still find ourselves running with very high levels of cases of coronavirus. And that provides a mixed context now for thinking about the weeks ahead. So we can look ahead to the spring, I think, with optimism, but it's essential that we continue to exercise caution and care. And really that means for us in Nottinghamshire, underlining once again that getting vaccinated still remains the single best way to protect ourselves and those around us from coronavirus. For people who are vaccinated, we need to continue to follow all of the behaviours and actions that are set out in Winter Plan A and in the guidance. So as well as continuing to use lateral flow tests if we don't have symptoms, but we're going to find ourselves in a higher risk setting or mixing with someone who we know to be vulnerable, and as well as taking a PCR test, of course, and isolating if we do get symptoms, we also need to come back to that advice and guidance again about making sure that indoors as far as possible when we are meeting with other people, that we make sure that the space is really well ventilated, because that can reduce the airborne transmission of coronavirus really substantially. We must come back again and remind ourselves of the value of wearing a face covering in crowded and enclosed settings where we're coming into contact with people that we don't normally meet and mix with. And of course, washing our hands with soap and water, or using hand sanitizer if we can't wash with soap and water, is and doing that regularly and frequently through the day is another really effective way of limiting the spread of coronavirus. So my really message at this point of transition, is that the pandemic is not yet behind us. And as we return to Winter Plan A, we need to act carefully and remain cautious. Thank you, Steve.
Thank you, Jonathan. We'll move over to the City Council update from Lucy Hubber.
Hi, good morning, everyone. In the city, we have seen a very rapid decline in the number of cases over the last week, and we are now at 820 per 100,000, which is nearly half the case rate that we had the previous week. But that is still really high. We mustn't think that halving in itself is enough. That 800 is still an incredibly high case rate, and still means that every week hundreds of people are testing positive. Yesterday, we heard that nationally, 1 in 20 people were still contracting COVID every week. We're also beginning to see that decline is now flattening off. So after a very sharp decrease, we're beginning to see it stabilise. And so we might find ourselves at these high rates for some period of time. And whilst we're seeing decreases in almost all age groups, actually the case rate is increasing in some of our school age groups, particularly primary age children. And so we still need to think about all of the things that we can do to keep ourselves and others safe. The move back to Plan A from next week doesn't mean to say that we have to stop doing everything. It means that there's lots of things that we still need to think about doing. And I'd like to thank our population for being just amazing over the last 8 weeks about really stepping up and taking all of the actions that we've asked them to do in order to protect themselves and others. And in the city, we've seen fantastic participation in testing. And that still remains one of the most important things that we can do. Get tested regularly using one of the rapid tests if you're meeting people, if you're going out and about to maybe crowded situations or likely to be around people that you know are going to be vulnerable. If you test positive, isolate. And I'll come back to isolation in a second. If you've got symptoms, no matter how mild, and what we're seeing with Omicron is some people presenting with very mild symptoms or even slightly different symptoms. So if you're not feeling quite right and you think to yourself, maybe I ought to do a test, please get one of the PCR tests. If you've got any sort of symptom, one of those tests that has to go off to a lab is the right test to take. And if you've got symptoms, you should isolate straight away until you get that result. Anyone who tests positive has to isolate for 10 days. Now, I'm saying that because it's really important that people understand that the duty to isolate is still 10 days. However, on day 5 and day 6, you can start to take rapid tests and you can stop isolating from day 6 if you've had 2 negative rapid tests. If you still test positive on day 5 or day 6, you have to still keep isolating. You can carry on taking rapid tests until you've had your 2 negatives or until you've done your 10 days. That's really important for people to remember. What we know is that people can still be infectious even after 5 days. And so it's those 2 negative tests that give the assurance, otherwise you have to stay at home. The other thing that's really important for us to think about is what face coverings and what hand washing and what social distancing have offered. We've seen really low rates of flu in the last couple of years, and that's largely driven by the fact that we're being careful if we've got symptoms, we're wearing face coverings and we're washing hands. So it's not just about COVID, it's about all of those other winter diseases that we have. And this is something that we might want to carry on in future years, just being slightly more cautious that if you've got any sort of wintry type symptoms, that you keep your distance, you wash your hands more and you wear face coverings. I would encourage people to continue thinking about wearing face coverings when they're in crowded or indoor settings, and I'll certainly be wearing mine as I have done all the way through. Thank you, Steve.
Thanks, Lucy. And finally, we'll come to Amanda Sullivan from the NHS.
Thank you, Steve. Morning, everyone. So our hospitals continue to have a high number of people in hospital with coronavirus, although this has levelled out. So we saw 264 admissions in the week leading up to the 16th of January, compared to 286 admissions in the week prior to that. 15 people were on ventilators and in the most critical condition. And there were 22 deaths in the week leading up to the 19th of January compared to 39 deaths in the previous week. So the last few weeks have been incredibly challenging for the NHS, but thankfully we are not seeing hospital rates continuing to rise in the way that they did this time last year. And this is directly related to the fact that over 84% of people over 18 have now had 2 jabs, and 64% of over 18s have now had their booster as well. And people are still coming forward for their jabs, which is great. First jabs, second jabs, and third jabs. And I'd really like to thank people for doing that. Thousands and thousands of people did get boosted over Christmas and the New Year, and this will have had a big impact on keeping people well. So vaccines do remain the best way to protect yourself and others from serious illness and death from coronavirus. And this is particularly important as we talk about restrictions easing and people being more likely to be in contact with others. We know that we still have pockets of our communities who are to come forward for their jabs. And because of this, we're putting on special question and answer clinics where people can come, walk in, have a chat with an expert. It's a chance to answer any concerns that you have or discuss your views or thoughts without any pressure to have a vaccine. We do have a clinic today running in the Asda at Hyson Green until 3 o'clock. This is a new offer. It's not in vaccine centres, it's separate to vaccine centres, and it's proving to be very popular for people who have got questions and concerns. And we're also going out and about doing more of our pop-up clinics in community venues. We're going into mosques, other known settings, really well-known settings as well across our communities. So we'll be continuing that programme in the coming weeks. And we do have some special clinics as well for certain groups that you might feel a bit more comfortable to attend. So examples of this have been women-only clinics, only women on site at any one time, special clinics for people with learning difficulties, and people who've got needle phobias as well. We have got special clinics for those people as well. So thank you. That's my update. Thank you.
Thank you, Amanda. We'll come now to questions from the media. As always, it's one question and we answer then one follow-up question. I'm looking at the hands raised. The first one on my list is Matt Jarrah. Matt.
Good morning, all. This is a question really just for Amanda. With the restrictions being lifted very soon, are you worried about the implications this will have on hospitals, and what are your feelings around this? And I suppose my follow-up question again to Amanda, and I'm quite happy for Jonathan or Lucy to chip in as well. Is it becoming a bit of a lost hope for those who are not getting their vaccines? And what sort of pressure is this putting on the NHS? Thank you.
Thanks, Matt.
Yeah, thank you, Matt. Yes, thank you. So, I mean, as we've already said, I think with the easing of restrictions, it still is really important that people do follow all of those normal precautions, and hospitals and healthcare environments are not changing our current procedures around infection prevention and control. So if you go to your doctor's surgery or if you go to the hospital for any reason, those procedures and precautions will still be followed. And if you are in hospital with coronavirus, you will still be, cared for in that way that is helping to prevent the spread of any infections. So the restrictions will not be eased in the healthcare settings, and we would still very much encourage people to be cautious. And the advice remains the same about having your vaccine. It is the best way to prevent yourself or those around you from becoming seriously unwell. So do please keep getting your jabs. In terms of is it I think your phrase was, is it a lost hope? Actually, I'm really encouraged that in the last month or so, particularly with Omicron, we are seeing people coming forward who have been reluctant, but are now really coming forward. They may come initially with some concerns and questions and then make a choice. But we are definitely seeing a rise in people coming now for first and second jabs as well as the boosters. So that is very, very encouraging. And it is, in the tune of thousands each week are choosing to do that. But that's one of the reasons why we have set up these question and answer clinics. As I say, they're not part of any vaccine centre, so you can go along, without feeling that you're going to be sort of pressured into having that vaccine there and then. They are literally for expert advice. It might be about your own personal circumstances. If you've got any health conditions, you're worried about that, you can get that individual advice. So I would encourage people still to do that. Thank you.
Thank you, Amanda. That was really comprehensive. Jonathan, Lucy, I'm not sure there's much we can add to that unless you wanted to come in on any of those points.
I just wanted to reinforce Amanda's last point in that it is never too late to come forward and have your vaccine. We've seen thousands of people coming forward having their first and second dose over the last few weeks. And what we would ask people to do is to make an informed decision, not from what they've picked up from somebody on Facebook, but to come along and talk to us. And if their decision then is they don't want to get vaccinated, then at least they've had all of the information, the opportunity to talk it through. So strongly encourage people to come to one of the COVID information sessions, the vaccine information sessions, or along to one of our vaccine centres, and they can come and talk to people there. But just come and have the conversation. It's never too late.
Sorry, Amanda, just to touch on that one point that you raised. Do you think there'll be more hospital admissions, though, as a result of restrictions being lifted?
I mean, we're always, you know, advising people to be cautious. If you are vulnerable in any way, particularly, please do make sure that you get all of your jabs. So we are constantly saying, you know, in any event, do please think about your own personal safety and health, and do follow those precautions and use your common sense around that. So that again, that advice is consistent all the time.
Thank you all. Appreciate that.
Thank you.
Thank you, Amanda. Thanks, Matt. It's a really important question. So I'm glad we're able to talk about vaccinations right from the start. Next hand up is Joe Locker from the Nottingham Post. Joe, hi, Joe.
Oh, sorry. Hi there, guys. How are you all doing? Hope you're all well. A bit of a different question from us today. Just following the last briefing that we had, really. So obviously, we were told 74% of patients in critical care were unvaccinated at that time. And doing a bit more digging with NUH, we discovered this potentially only covered one single day, which was when there was 19 patients in critical care. Since then, with NUH have almost changed their kind of data, and it's now gone up to 41 patients in critical care. So obviously, you know, there's all talk of misinformation and so forth. So how important do you think it is that people have access to data that doesn't just cover one day? And I suppose, you know, if someone doesn't trust the authorities on vaccines anyway, how does data like this, you know, help with that trust? We're just trying to, you know, gauge a better picture, I suppose, of what's going on. Thanks.
Amanda, are you happy to pick this one up? Joe, I mean, obviously this is a COVID briefing, and I know it's a COVID question, but Amanda, we'll have a think about this one. But obviously, am I right? Are you asking in terms of the way that you're asking us to comment on the way that NUH has presented the data?
Sorry, Joe. No, just in terms of when we were first told, you know, the 74% figure. You know, we're just looking to see, you know, what you think of transparency, really, how important it is to be fully transparent, I suppose.
Yeah, no, thank you. So yeah, I mean, you're absolutely right, Joe, that figure is a point in time. And inevitably, as patients go in and out of intensive care, you know, numbers do change on a daily basis. And this is why, as well as giving, you know, an illustrative example, nationally that data is being collected, and more evidence is emerging all the time. And this is why, you know, there is surveillance over time. What I would say is that there is a very definite pattern, and Nottingham and Nottinghamshire are not different to anywhere else, in that there is definitely a greatly increased risk of needing intensive care if you are unvaccinated and you catch COVID, and that applies to all of the variants. So that is not, so I think in terms of the trust and things, it is you know, obviously we're collecting data all the time. It's a new variant, as Jonathan said. It's 8 weeks since we saw the variant in this part of the country. But I think it is very clear that if you are unvaccinated, you are at significantly more risk of needing to go into hospital, and particularly around that serious illness. So that particular figure was a point in time. We do sometimes do that. Just to reassure you, though, these figures are monitored nationally, and we are not untypical of that. And over time, you know, that obviously the length of the data will continue to grow. Thank you.
Thanks, Amanda.
Steve, I just wonder if I wonder if I might just amplify what Amanda has covered there. Joe, I think it's a really good question. I think when we're trying to get the big picture on something, picking up one bit of data it's like a jigsaw, and it provides us part of that overall picture, but it doesn't necessarily, I agree with you, it doesn't necessarily fill out the whole picture for us. I think it is worth just coming back to what the big picture is, as Amanda drew out. Vaccines remain an extremely effective way of protecting yourself and those around you, and they are most effective at preventing hospitalisation and those serious complications of coronavirus. Notwithstanding how effective they are, they're not 100% effective. And we do need to remember that when you have a surge as massive as we've experienced, that is going to mean that some people who are vaccinated will sadly end up in hospital alongside a large number of people who've chosen not to or haven't taken up the offer of a vaccination. So I think it's worth kind of coming back to just how effective vaccines are, but also the importance going forward of making sure that nationally and not in Nottinghamshire as well, we bring rates down to a level which are manageable for our services ongoing. That will be really important as well. Thanks.
Thanks, Jonathan. Thanks, Amanda. Joe, thanks for that first question. And I guess in terms of a commitment to transparency, we are here every fortnight, proactively holding a briefing, answering your questions. We are committed, obviously, as a collection of organisations, to making sure that we're here to present you with the information and answer your questions. So thank you for that one. Joe, do you have a follow-up question?
No, thanks, guys. That answer's very much appreciated and helps explain. So thanks for that. I guess the follow-up question is just in terms of again an outlook as to the future, I suppose. As you say, cases are generally coming down. Hospital admissions, I believe you said, were kind of flattening almost. So what's the kind of future outlook, I suppose, in the next few weeks and months?
Thank you. Who wants to gaze into the crystal ball first on that one?
Well, if Joe could pop in the post the crystal ball, and then we'll have a look. So we have seen cases coming down, but as Jonathan and I both said, there is the beginnings of actually showing some flattening off in that decline, and it'll be really interesting to see the impact of the changes of the guidance this week, and so I think it's really hard for us to be able to make a judgment. I think it's sensible for us to assume that certainly for the next 4, 6, 8 weeks, we're going to continue to see case rates higher than that we've experienced for a while, and that we're going to continue to be asking people to take these extra measures and these extra steps to be careful, the wearing of face coverings, the testing regularly with rapid tests, the getting tested if you've got symptoms and isolating, and of course getting vaccinated. And so we're continuing to push those messages really hard, because those are the measures that we know make a difference, and we've seen that because we've seen it now in the figures, and that our Omicron peak has been quite so soon. So that's my best guess, is that we are hopefully going to see a continued decline, but still requiring people to make those extra steps. I don't know how Jonathan or Amanda feel.
So thanks, Lucy. Yeah, I agree with what you've said there. Joe, your question was really reaching for what kind of outcomes we'll find. I'll answer the question or add to what Lucy said by just commenting on what we might see in terms of the way people in Nottinghamshire respond. And what I say here is not with any sense of presumption at all, because people across Nottinghamshire for almost 2 years now have gone to enormous lengths to stop the spread of coronavirus. And I just want to acknowledge that again, and to thank people for all the efforts that they've put in. But I think as we return to winter plan A, if I'm allowed a bit of crystal ball gazing, I think what we will see is that in general, people across Nottinghamshire will continue to act with care and with caution, coming back to the guidance that we have about how we keep people in Nottinghamshire safe. So based on what I've seen over the last year or two, I'm confident that we'll also continue to see that kind of thing going forward. Thank you.
Thank you, Jonathan. Joe, thank you for the questions. The next hand up I have is Hugh Caswell.
Morning, everyone. Yeah, Hugh Caswell from BBC Nottingham here. I mean, I think we've already covered a lot of what I wanted to ask, to be honest. So we may be going over a bit of the same ground here, but nonetheless, I'd welcome the thoughts of all of the panel. And going back to all those metrics, those figures that you've all talked about, they're all obviously coming down or flattening off from a high point. But just in terms of the, I suppose, the direction of travel, how hopeful, how confident are you that we're over the worst of this wave? And also, if so, has that maybe happened a bit faster than you expected? Because I think I remember, Amanda, you a couple of weeks ago saying that you expected admissions to track a similar course to last January and carry on rising towards the end of the month before they peaked and came down.
Thanks, Hugh.
Amanda? Yeah, I'll start. So yes, thank you, Hugh. So we were, as you say, last time when we did the briefing, we were tracking very similarly to last year. And last year they went as high as 750 people in our hospitals. At the moment, they're not at that level, and we have seen certainly over the last week that rise has stopped and has leveled out. So that is very encouraging. We are hopeful that plateauing will continue, and over time we'll start to drop even more. Typically, you do see it takes longer for hospital levels to drop than it does for case drops, just because once people are ill and in hospital, it takes a while for them to recover and to be discharged. So we see a bit of a lag in terms of that. So we are cautiously optimistic that we will continue to see this plateauing out for a while and then a gradual decline over time. But we are also conscious that if the rates in the community do rise, then we should expect to see that the hospital rates will also rise. Thank you.
Thank you, Amanda. Jonathan, Lucy, did you want to add anything to that?
I will just, in terms of case rates more specifically, I think we very properly focus on the pressures and the very severe pressures in our health and social care system. If I just think about case rates which sit behind that, we are feeling confident that we are now past the peak in the rates for the time being. If we look back at that peak and think of it as a mountain peak, we think still on walking along something of a mountain ridge with some steep drops. And some hazard potentially. So we've not yet come back down into the green valley where we can trip along happily without giving any consideration to the context that we're still in. And it is for that reason that we're wanting to remind people that we're returning to winter plan A. And that necessarily means that we need to continue to act carefully and remain cautious. And it's in that way that we're going to control the spread, and over time, we trust bring rates down lower still. Thank you.
Thank you, Jonathan. Hugh, did you have a follow-up question?
Yeah, again, it's something that we've already touched on today. That you mentioned there, Jonathan. Of course, we're coming to heading towards coming out of the Plan B restrictions. But would you and Lucy as well? Would you maybe encourage people to still keep going with some of those things, like mask wearing, for example, just as personal choice maybe? And Lucy, I think you mentioned something on this, but will you both continue to wear a mask in some places where you don't necessarily have to?
That's a really good question, Hugh. Who would like to go first?
I'm happy to go first because I put this in my opening comments. I have worn a face covering all the way through and I will continue to do so in those crowded or indoor settings, because that's my way of protecting those people around me, as well as testing regularly to make sure that I'm not putting anybody at risk. So I will continue to do so, and would strongly recommend that other people do the same.
And perhaps I can just echo that. Similarly, I've chosen to wear a face covering in a number of situations over time where I might not have at one point been mandated to, but where it's been a prudent thing to do in terms of protecting myself and those around me, and is part of my acting carefully and remaining cautious. Of course, along with so many other people across Nottinghamshire, I am looking forward to a point when I can perhaps relax some of those arrangements and measures as well. But for the time being, I'm going to be acting carefully and remaining cautious.
Thank you, Jonathan. Thanks, Lucy and Amanda. Thank you for the questions, Hugh. Final hand I can see is Rachel Lewis from ITV Central.
Hello.
Hi, Rachel.
Hello. Yeah, so my question's also slightly been covered already, but I just wanted to more specifically, just after that conversation as well. Some people in Nottinghamshire might be, look, we just need to live with this virus now. We need to get on with life, get back to normality again. What would you say to that? Can you specifically explain why it's so important for people to still be listening to what health experts are telling them, and what the best ways are for us to eventually return to normality?
Thanks, Rachel. Lucy?
Yeah, happy to. So for me, living with COVID doesn't mean to say that we don't do anything. And I think that's really important, is if we are going to learn to live with COVID, that doesn't mean to say we just go, oh, no, there's COVID. We have to continue to think about the things we need to do to protect those who may be more at risk of COVID. And we're still learning about COVID. We have to remember that we've only had 2 years of understanding this virus, and it has changed enormously in that time. Omicron, very different from the wild virus that started. And we're learning about long COVID, and we're learning about all of the impacts that that's having on people. So as we learn to live with COVID, and at the moment we're living with 2,700 cases every week in Nottingham. That's 2,700 cases every week. That's really a high number of people whose lives are affected by it, and who are at risk of serious illness, long-term damage, or even death. We are still seeing death. So we must remember that COVID remains a serious illness. Until we move to a position that we have a stable number of cases, we don't get the ups and downs, we don't get all the different variants that mean we have to do other things, we're going to need to learn to adapt our lives to live alongside COVID. And that includes things like the testing, things like wearing face coverings, things like not being around people if you've got symptoms. And we're going to carry that forward, I think, for some time to come, that next winter, we'll be asking people again that if you've got coldy-like symptoms, that you try and stay at home, that you try and keep your distance from people, that you wash your hands, that you wear a face covering, because these are the things that make a difference. And we can see from our reduced number of flu cases and flu deaths over the last 2 years that actually that background level of flu that we've always accepted before, actually we don't have to have. We can make differences. So we can not only live alongside COVID, but we can live alongside flu differently as well, if we just make some changes to all of our behaviours, and changes which really aren't very difficult to think about. So for me, living with COVID is about all of us thinking about those things that we just need to change in our everyday lives, so that we don't get these periods of high restrictions, but the things we can all do all the time. And getting vaccinated still remains one of those things that gives us the most chance of that stable future, where we have to do less in order to live with COVID.
Thank you, Lucy. Jonathan, did you want to add anything?
I will just to say then that I understand the question, Rachel, and I agree. The direction of travel is as you indicated. It's towards us reaching a point where we're able to live safely with COVID in the way that Lucy's just described. We are not there yet. The pandemic is not over. If you needed evidence of that, we just need to go back to what Amanda has been describing to us and remind ourselves about the situation in our hospitals, for example. But to get there, and we can get there, at this point, we need to follow Winter Plan A, and that is very much then about acting carefully and remaining cautious for the time being.
Great. Thank you,
so much.
Jonathan. Thank you, Rachel, for the question as well. I'll just pause briefly. Are there any more questions? I think we may have covered everything. Great. Okay. In that case, I'll say thank you to Lucy, thank you to Jonathan, and thank you to Amanda, as always, for your time in being here today. Thank you to media colleagues for helping to keep the public informed about COVID-19. I wish you all a happy Friday and hope you have a lovely weekend, and we'll see you in 2 weeks. Thank you, everyone.
Thanks all very much.
Thanks, everyone. Bye now.